what?
Brachialis.
I don't think they'll ever be
Brachialis.
right.
Brachialis.
No, chances are no. There's two triceps. Why would I say that biceps and triceps are the two that you're really worried about?
Two joint muscle.
Two joint muscles. When you talk about muscle shortness, you're pretty much talking about two joint muscles, not one joint muscles. As Nick said, what do we worry about with one joint muscles? Tightness / stiffness. What muscles can be tight or stiff? What's the most common in the elbow? Pronator teres, because it gets a special name, pronator teres syndrome. That is a common one.
Your supinator, or does that cross? Your supinator, wouldn't that be super tight too?
It can be, and that would restrict what nerve?
Radial.
Radial.
Oh, yeah, radial, right?
In particular, I'm pretty sure posterior interosseous nerve, motor only version of the radial nerve, I think, under the supinator. Okay. This looks exactly the same because it is. Your grades don't change. Why does a grade 1 and 2 help with pain?
Tells the nerves to relax.
Ah, you said it! Damn.
What's that?
Neuromuscular
You don't want to facilitate something.
adaptation.
Tissue slack is possible, so if you don't want to facilitate tight muscles, what do you want to do?
Muscular relaxation.
Relax them. So it has a neuromuscular inhibitory effect. You can say that in different words, so you don't have to memorize that. So it's telling the oscillations, telling the nerves that are hyperactive to that muscle, calm down. Relax, take a chill pill. 3s to 5s, we didn't learn 5s yet, so 3s and 4s help range. What are we trying to improve? Capsule restriction. Muscle length, relax it if it's tight, stretch it if it's short. Breakouts. This does not change. Your manual muscle tests stay the same. So this is where, someone grab a seat. There you go. Yeah, they can't see nothing. Face that way. All right. So this is similar to resisted tests, but what is the difference between right now versus resisted tests?
You're getting a grade, you're doing a formal test.
It is formal, but
Inner range, you're doing all the inner range.
different ranges, and I'm putting a grade to it. So with this, if I want to do biceps, I want you to bring your hand towards your shoulder. Okay, good. Contraction there, he's at least a 1, went through range, that means he's at least a 3. Great. So then we're going to do a nice 5-second hold. We're going to get appropriate stabilization. He's in his inner range as much as he can go. Oh yeah. No, so the thing is, I want you guys, that's fine to laugh about that. That's great. I would be the same position if it was the smallest person in this room. So that's usually the biggest people in the room have the worst body mechanics because they're strong. Good. So hold. So then we go 1, 2, 3, 4, 5, and he was able to hold inner range well. So then, do mid range. Ready? 1, 2, 3, 4.
Is that your elbow? That's my elbow.
Yeah. It was fine. So I started with a little bit of resistance, and over 5 seconds, gradually increased it. Stabilized so that he doesn't sway one way or the other. Okay? Even though doing this and this doesn't actually change muscle activation, conceptually you can do that as well. So you can do thumbs up. Good. Bring that towards your, relax, I didn't say go yet. Go ahead. Okay, good. Hold it up there. 1, 2, 3, 4, 5. Okay, and then you can do relax, champ, you got it, good. And then bring this up towards your shoulder, good. And hold. 1, 2, 3. So he loses a little bit with those two, but it's nothing, he's not here with elbow pain, there's nothing drastic there. But still, it was a little bit less than biceps, so. Little pain? Oh, that's good to know. All right, so I'd take note of that, even though I didn't do any of my screens.
There you go.
So that was something we would address. So those are your 3 main ones, and then same with pronation and supination. We want to do an end range now, so hands all the way up. Good. You already did it. Good. Feel. All right, 5 seconds. Hold there. 1, 2, 3, 4, 5. Hands all the way over, good. And hold. And those are those at inner range. You guys know how to do it mid-range because we did it with the screen. I think that's it. Oh, triceps. Laying down. Go to your right. Good, stop right there. Okay,
Do you
we're gonna
pillow?
imagine there's a towel propped up right there, so it's, no, fluffy pillow, whatever.
Oh, my finger. There you go.
Okay, so we're gonna stabilize the scap. I am not gonna do it, or first put your arm all the way up. Good. So he has a 3, right? 3, you got full range. I'm not gonna test it here, why? It's gonna lock into the bones are gonna lock in. So think of it like the knee. You need to unlock it a little bit. Relax. Good. Hold right there for me. Good. 5, good. Then we can check that one.
So that's more mid right there.
Yep. And that's it. Just make sure that you don't wanna test here. You wanna just break it a little bit. Sound good? I like to stabilize the scap.
For the mid-range here, will the table give us a false reading? Because he's scoot over.
You can always scoot over a little bit. You can come here, or you can do it there.
And no, it's not a false reading.
You're looking at quality of motion. Is he complaining of pain? Does he give? Is he compensating at all? That type of stuff. But all I care about, to me, that's 5 out of 5. There didn't seem any complaints. I didn't see any gross compensations.
One question. Yesterday we were learning in terms of like inner range and outer range in terms of moving the shoulder. How's that different from what we're gonna say? Like, let's say for example, if we did inner range at the for the long-handed bicep, we bring them up all the way over here and do it. Yeah.
Yeah.
So what you saw yesterday was Dr. D doing tricep strength testing in different positions, and it was pretty much done in upright. And then the question came up, well, what about standard manual muscle test position? She's like, oh, well, you can do your brake test in these positions. And that's true. There are different authors that are describing different ways of doing manual muscle test. So what she was showing was a very quick way to get through most of your people. However, the hallmark of a manual muscle test is the brake test. Therefore, you have to put enough resistance into that muscle to get the break. So if you're using the positions that Dr. D showed you yesterday and you weren't effectively getting a break and you're testing Dave, that's not a 5 out of 5. You have to put him into a supported position so you can get enough resistance through that muscle to start to get a break. So it's being supported by the table is not a false finding. It is getting enough support so that you can put enough pressure through there in order to get the break test. That's how you're going to get the proper test. There are some people that we can't even get a break through a manual muscle load. Athletes trying to test their quads, I can jump on their leg and I'm not going to get them the break. So I have to load them up in order to actually start to get a sense of when the break is occurring to get an accurate assessment. So, and keep in mind, we did 2 things. We did a motor control breakout and a strength breakout. We are specifically doing a strength breakout here. So you still can bias it for different muscles, but you have to put them in a position that allows you to get the break to get an accurate reading.
The other thing too is, I know we're talking about the elbow here, but the board exams will never test you on specific authors. So they only care about, doesn't matter what author, if I want to test the triceps against gravity, they're going to describe answers that will have to do with him being in prone because that is against gravity. So they have to put in the stem something to do with what they're asking for, and that's not author dependent because this is the only position that's really truly against gravity. Same exact concept of there's no norm for, we'll use the ankle as an example because this will be different authors. Technically, for the calf, against gravity, point your toes towards the ceiling.
My toes.
Yep.
Like that?
Well, keep this down. Just point your toes. Good. So if that's against gravity, this is the against gravity position. I'm going to test it. That's technically a 5 against gravity. But other books will tell you normal MMT, literally a 0 to 5 grade, Unilateral calf raise. So which one is right? One book. What? They're both right. So it just has to be applicable towards what is in the stem. If you see a stem that starts talking about weight bearing, I wouldn't do this. If you see just against gravity, this is a good one. So just be aware that don't worry about that as much as what are you trying to accomplish. All right, so that's strength. Do you guys need to practice that all? Or are you okay? Okay. Next, Dave. So here's just a break.